We can't clone them. And it's discarded as medical waste. If it's not collected and donated to a cord blood bank, it's just discarded as medical waste in the delivery room.
So the awareness really is probably, what would you characterize it as, low, medium, or high in terms of about the
For
cord?
the public cord blood banks, probably low. For the privates, they spend a fair amount of marketing dollars and target these moms during the pregnancy. So if you pick up a parent's magazine or child magazine, there's a lot of advertising within those publications.
Mm-hmm. But we really haven't seen a whole lot about it on community health kinds of public service announcements or anything like that. It's not something that really people talk very much about, at least in my limited part of the world, I guess. Have you experienced something different? Obviously, you work in it, so.
Correct.
Yeah.
And again, if you pick up those publications that are targeted at pregnant moms, there's plenty of information out there on the private ones.
Okay. All right. Well, let's move on to the cord blood stem cells. Exactly what are we talking about when we say, stem cells from the cord itself?
Again, the only standard of care use of cord blood stem cells at this point is to repopulate the bone marrow during a bone marrow transplant.
And that's the only way that it can be used?
At this point, that's not considered research-based.
Okay.
There's a lot of work going on out there, so in the future that may well change. But right now, that's the only standard of care use that's considered non-research.
Mm-hmm. And fairly common. When somebody has leukemia and they need to grow the bone marrow, they used to do the transplant of bone marrow.
Correct.
Now they will go, is this a more technology kind of higher technology base?
It's often used for those patients that can't find an adult marrow donor.
Okay.
There are some advantages of cord blood is because it's coming from a baby, the cells in it seem to be a little naive, so they don't cause an often fatal condition called graft versus host disease. You see that if you can't find a perfect match in an adult bone marrow, the doctors will then turn to cord blood because the cells don't cause that graft versus host disease as readily. Also because of that, because those cells are naive, you can get away with a lesser match. You're matching tissue antigens when you're looking for that graft to match the recipient. And because those cells in the cord blood are a little naive and less fussy than what the adult cells are, if you can't find a perfect match, you can still have a successful transplant with cord blood as opposed to bone marrow.
And so, but the likelihood of using an adult transplant is better, is what you're saying, if you can find a match.
Correct. And it's transplant doctor preference. Some of them like cord blood over bone marrow. There's a longer history with bone marrow at this point, so I bet most doctors would prefer the bone marrow as a first choice. So it depends on the condition they're treating and the transplant doctor that's going to be doing the transplant.
Okay. And what are stem cells? We hear so much about stem cells, and I'd ask you to make the comparison or the difference between what we hear in the media about stem cells and what we're talking about here today.
The stem cell we term the mother cell. It's the
mother
cell
cell
that can make all other cells. And again, with our program, the use of these, the only non-research use right now is for bone marrow transplant. So it's the cell that's going to make your red cells, your white cells, and your platelets, which are your blood cells. There is research going on to kind of train these cord blood stem cells into making other types of tissues so that they can become nerve tissue or cardiac tissue.
But that's something that your organization cannot supply the cord for.
Correct.
Because you are only certified for, again...
The only standard of care use that's non-research right now is bone marrow transplant.
For the whole United States?
Correct.
Okay.
Correct.
Okay, but that research is still going on?
Correct. Just not at our facility, but a lot of it going on worldwide.
Okay. How do cord blood cells different from other stem cells?
Cord blood stem cells are actually considered adult stem cells. So
even though they come from a child?
Even though they come from a baby.
Why would that be?
Most people put them into two groups, either embryonic or adult.
Okay.
So cord bloods fall into the adult because they're definitely not embryonic. But they're kind of like immature adults. They seem to be a little more
You call them naive.
Yeah, they are naive. The T cells in there, which is one form of white cell, are definitely naive. So they're easier to train to do things than what true adult stem cells are.
Mm-hmm. And your organization has capacity for only 350
per year.
Per year. Do you use all 350? Have you?
The chance of matching is only about 1% because the tissue types in people are just so vastly diverse. So only about 1% of these match, and that's a national standard, not just our bank. So we're banking 100 for every one that ends up matching someone and being used for transplant.
So your storage facility must be pretty large.
We have pretty large tanks, but you can store a lot in there, about 1,200 in a tank.
Okay, huh. How are stem cells used then? Different than the cord blood stem cell? Again,
even with the adult stem cells right now, the only standard of care use of them in the U.S. is for bone marrow transplant.
Okay. Maybe you could take us through the process of how a doctor goes about contacting your organization, or maybe we just back up and start with the transplant itself, or the getting the cord, and then kind of the steps to how it makes its way to your organization. And then once it's at your organization, how it actually gets to the person in need.
Okay. We distribute our pamphlets to all the OB and family practice offices for the areas that we serve. We currently serve 15 hospitals in Michigan.
These are the big hospitals?
Not necessarily. Some of them are a little bit smaller, but they're clustered around where our blood centers are. So up in Traverse City, it's Munson Medical Center. We serve the greater Grand Rapids area, and then Saginaw Bay City, Midland, and Niles and St. Joseph. So it's the hospitals in the areas where we have our whole blood facilities. So we distribute our pamphlets to the doctor's offices, also the prenatal educators for the moms going to take their labor and delivery classes. So it's pretty mom-driven. If she sees our pamphlet and it's something she's interested in, she gives us a call. We have a toll-free number of 866-MI-BLOOD, and we do a brief 2-3 minute pre-screening of mom on the phone just to make sure she doesn't have any disqualifiers that would keep her from participating in our program.
What kind of disqualifiers?
If there's any history of hepatitis, that would disqualify. Sometimes travel. If they've been to a malarious area, that will defer them for 12 months.
Pretty much like donating blood.
Exactly like donating blood.
Okay.
The things that would be different is if there is genetic disease in the family.
What kind of genetic disease?
Sickle cell, muscular sclerosis, cystic fibrosis, something with a genetic link so that if we would transplant that graft into a recipient, that recipient would then have that condition. So brief pre-screening with mom on the phone, and almost probably 95% of the people we talk to are eligible for the program. Another common one that defers them temporarily is tattoos or piercings.
Oh, that's interesting. What do you mean by that?
If they've had a tattoo in the previous 12 months, they have to wait a 12-month period after receiving that tattoo because of the risk of hepatitis. So if she won't deliver by the time that 12-month period is up, she won't be able to donate that cord blood.
And piercing is along the same lines, the hepatitis?
Correct. If they use, correct, it's a hepatitis risk. If they use sterile disposable equipment, like if you go to a salon for your ears, that's fine. But any high-risk piercings that weren't done with sterile disposable equipment, they have that 12 months that they have to wait.
You know, I've often wondered whether piercing or this new fad of tattoos, if that would pose any sort of medical risk or medical problems. And would it be the same for if you were donating blood?
Correct. The FDA views that as a hepatitis risk.
Okay. Very interesting. Okay, so those are some disqualifications.
Right.
Then once, I lost where we
so
stopped
if mom
there.
is eligible based on that pre-screening,